In just 7 weeks' time, a new giant database will be created containing patients' medical data obtained directly from our GPs. Now, you may have seen a leaflet drop through your door, but do you understand exactly what it means and what your options are? Are you concerned about how your private information relating to your health may be used by others, including drug companies and insurance firms? So listen to what we got to say here, then give us your thoughts on it. This new central database will enable experts to assess diseases, examine new drugs on the market, and identify infection outbreaks, as well as monitor the care that patients get. Now, the data will be collected automatically from GP surgeries, and the only way to stop your medical records being used is for you to opt out before this happens. Otherwise, your information will automatically be included. Healthwatch England said last week that the scheme should be delayed as patients had been left in the dark. And now GPs are saying there's a crisis in confidence about the new database. Well, I asked Dr. Neil Bhatia, who's a GP in Yateley, North East Hampshire, what his concerns are.
Well, I would echo what Healthwatch has said, really. The main problem is that patients are simply just totally unaware that this is happening. The leaflet that was given through people's letterboxes, if they received them at all, which many people apparently didn't, I think was very unclear and misleading, and really didn't tell you what was going to happen with your information that you thought was going to be kept confidential at your GP surgery, how it's going to be used, and who it's going to be given to, more importantly.
Okay, before we come on to that, in principle, is it a good idea that other experts who may be treating you have access to your full medical record so they at least know what's gone before them? I mean, that sounds like good common sense.
It does, except that the information that's being uploaded from your medical records for this programme won't be available to medical professionals.
So who's going to use it?
Sorry?
Who's going to use it then?
Well, that information is going to be mined, analysed, put into groups and given to a wide variety of organisations. Some of them are within the NHS who are looking to plan health services. Some of them are going to be out of the NHS, such as pharmaceutical companies, research organisations, commercial companies, insurance companies. The important thing is that this information will not be used by doctors or nurses or any of the health professionals that you might see either in your GP surgery, accident emergency, in a hospital setting, whatever. It's not available to medical professionals. It's not about information sharing for providing medical care.
Are you telling me this is the cart before the horse?
Well, I think what people are confused about is that they think this is similar or the same scheme that has been rolling out over the last 5 or 6 years across the country slowly, called the summary care record, where a very small selection of your medical information is being made available to A&E doctors or doctors in out-of-hour GP surgery. But this is completely different. This is secondary uses of your medical data. So this has nothing to do with your medical care whatsoever, which is why whether you opt out or not, it will have no impact on your day-to-day medical care that you get from your GP or from any specialist that you see in hospital or any health professional that you see in any other setting, both within the NHS or in the private system.
For the purposes of this, Neil, I'm your patient. I've been to see you several times. You know all about me. You've got all my medical records. They are automatically gleaned from your system to go into this database, which can then be mined and analysed by people within the NHS, people outside the NHS. Will I ever be able to be identified personally as to who I am from this data?
You can be, absolutely. The data is uploaded with fields that are unique to you, your NHS number for a start, your date of birth, your postcode, your gender, and that information can very easily identify you personally. Once the information is up with the information centre, it then can be released in a number of ways, either anonymised, which would be extremely difficult to identify you. It can be pseudonymized, which means that some of those identifying fields, such as your date of birth and your postcode, are hashed up and mangled so that it becomes very much more difficult to identify you, although you can still be identified if that information is given to an organisation that has other information about you. And under certain circumstances, and it has happened, and it does happen, that information can be released in a clearly identifiable format and given to organisations. So absolutely, yes, you can be identified. That's why the information is uploaded in that way.
And you haven't even spoken yet about accidental releases where, I forgot to anonymise that particular field which releases your exact name and address.
Yes.
I'm terribly sorry about that. Or the day that a whistleblower walks out with the data of all those people on a memory stick.
Yes, absolutely. I mean, whenever huge quantities of information are stored in one area, particularly, let's face it, when it comes to government departments, there's always that risk. And that risk becomes increasingly so when the information is so rich, so personal, and so sensitive. Anonymized data, in theory, you shouldn't be able to be identified from it, but the information that the information centre is going to collate on you is so detailed and so rich and has so much information that it's certainly starting to become quite possible to, under certain circumstances, identify people even from data that's been thoroughly de-identified, especially if you've got a rare condition, for example, or you're the only person in North East Hampshire with a particular problem.
So I can see why you're nervous about it. What action can we take? I mean, there's been quite a history of digitising the NHS details, haven't there? I mean, because it would be lovely to think all this was, available to the medics who might be treating you, and they could get the best information about you. That still hasn't happened, but we're doing this other thing first. So what are your immediate concerns, and what could we do about it between yourself and your patients?
Yeah, I mean, I think that my immediate concerns really is trying to get as many people to be aware of what's happening. I think the leaflet that we may or may not have got through our letterboxes wasn't clear. I think you need to look at your surgery website or go into your surgery, see if they've got any more information. Go on the internet. There's increasing amounts of information now about care.data. I've created a website for people if they want to look at it with all the information that I have managed to glean about care.data. Think about it. Decide whether you're happy for this to happen to your information. Be aware that you have pretty much very little or no control over the information once it's gone from your GP surgery. You've got no say in how it's used, who it's given to, for what purpose, how much the information centre are going to charge organisations to access your data.
Oh, so they'll sell on our details, our medical details?
They have been, and they will, yes. I mean, the organisations don't get this information for free. They have to pay the information centre. The information centre say, well, we don't make a profit and it's cost recovery. But, they trade data for money. And, yes, it is going to be sold. And many people don't like the idea of that, and many people don't like the idea of their information being used to assist organisations that make a profit or that are involved in aiming to provide private services to the NHS. People have strong feelings about privatisation in the NHS. People may not wish to support commercial organisations. You can't...
Various sorts of research that you may be opposed to, that sort of thing.
You may have ethical objections to the organisations that are going to access your information. You won't be told when your information is used, for what purposes, who's it given to, when it's given to. And neither can you specify, yes, you can have my information, but not if you're going to give it to commercial organisations, or I don't want you to give it to. You can't... So
you're either in or out, and that's all there is. Okay.
Absolutely. It's in or out.
And the clock is ticking. The clock is ticking. We've got 7 weeks.
Yeah, well, actually less than that. I mean, the first uploads are going to start in March. We don't know which practices are going to be starting. It's going to be probably about 1 in 100 practices are going to upload their information in March. Then they're going to test the data, see it hasn't been corrupted, and it's got there all right. And then maybe a few weeks later, 1 in 10 practices will upload, and probably by around May, all practices will have uploaded. So, in theory, it's quite possible that your surgery will be uploading all its patients' information within 2 to 3 weeks.
Okay, so it's a case of think about it, act now, find out the information, and make your choice now. So, please tell us, first of all, the website you've set up, Neil, that we can have a look at.
Yes, it's www.care-data.info. And that's a website I've set up over many months now when I, as a GP, wanted to give my patients far more information than was available at the time. And as more and more GPs realised about the system, I've added to that. So that's certainly one website. There's another organisation called MedConfidential, and their website is www.medconfidential.org. They have a very good website. They're an organisation that promote consent and confidentiality within the NHS and NHS records. by all means look at the official websites, the HSCIC, the NHS England websites, that you may or may not have found at the tiny writing at the bottom of your leaflet that you got through the letterbox. So, and so on my website and Med Confidential, it tells you how to opt out. NHS England didn't include an opt-out form in their leaflet. They keep telling people, go and see your GP. You don't need to see your GP. You can just fill in a form and drop it off at the surgery, send it in the post, fax it through. Some GP surgeries will let you email it to them.
Dr. Bhatia, that's some really useful information. I can understand your concerns on behalf of your patients there. Can I ask you personally, and you don't have to answer this, whether you've stayed opted in or you have opted out?
No, I opted out, and I opted my children out as well, and I would remind everybody to think about their children, because unless you opt them out, their information's going to go up, and then when they grow up and they're 16, 17 and they realise this has been going on, they won't be able to do anything about it. Once the information is with the information centre, they've made it very clear that no one will be able to delete or wipe that information. It's theirs forever to keep, to do as you wish, and your kids may not be very happy when they're 16 or 17 to realise this has been going on for however many years. So if you opt them out, at least when they're old enough to make that decision for themselves, they can opt themselves back in.
Dr. Neil Bhatia, GP from Yateley, speaking to me earlier. So that website that he's put together again is www.care-data.info. That's care-data.info. Or the alternative website he mentioned was medconfidential.org. medconfidential.org.